Because when we look at this model that I mentioned earlier called stress generation, I find this literature about depression fascinating as well. It's one of the newer models, but it has already attained a level of empirical support that is truly impressive. And, we learn, of course, when we're in this field, never blame the victim. Never blame the victim. And the goal here isn't blame, but it does acknowledge that the person plays a role in their own depression. And the stress generation model attempts to identify what are the ways that people contribute to their own depression. What are the behaviors that they engage in, for example, that have unintended consequences of making life more stressful? One of the exercises that I would encourage you to do if you have the time and inclination is if you take the files of all the cases you've seen, let's say in the last year, and you divide all of those cases into two piles. One pile is the pile of people who are suffering depression because of no fault of their own. They're sitting at a stoplight, they get rear-ended, and now they have health problems and financial problems because they can't work, and all these things that are really depressing to them that are caused by something not of their doing. And then if the other pile, the people who are suffering because of the things they actively did. The person who smoked for 30 years and now they're depressed when they get the diagnosis of lung cancer. The person who says to you, well, how did I know I was going to get fired just because I was having an affair with the boss's wife? And you're thinking to yourself, yeah, like who couldn't have seen that coming? But it opens up then the opportunities for prevention. And it's prevention I'm going to end up talking about at the very end of our time together today. But the point is, people do things that make their lives worse. I'm a depressed man, you're my wife. You say to me, Michael, I'm worried about you. And I say, leave me alone. And my depression goes on and my depression gets worse. And then you come to me again and you say, Michael, this has been going on for quite a while already and you're not getting any better and I'm worried about you. Why don't you at least go to the doctor? And I say a little louder, leave me alone. And more time goes by and my depression gets worse and you come to me again and say, this is horrible. I hate seeing you like this. You're really obviously way down. You're unresponsive. You're humorless. You're a drag to be around. Why don't you please go get some help? And I say, leave me alone. And more time goes on and more time goes on. And I'm not going to work and my job's threatened and I'm so difficult to be around. You don't even want to be in the same room with me. And my kids have stopped coming to visit and my friends have stopped coming to visit. And I look bad and I smell bad. And you come to me and you say, this is it. I've had it. You need to get help. I don't know what to do to help you. You go to a doctor, and if you don't, I'm leaving. I can't live like this. And I say, whoa, you would do that? Really? And you say, you bet. I say, fine. I'll go see a therapist. And I end up in your office. Sitting in your waiting room. Your magazines are outdated, by the way. Finally, you come get me, lead me into your office. You start talking to me, and gee, you seem nice. Ask me my history of my symptoms, marital history, occupational history, social history, history of my history. The hour's up. You say, come back next week. I think I can help you. Am I coming back next week? Probably not. Nothing happened in that first session to lead me to believe that things can change. In the world of depression, clients have a huge mortality rate. A mortality statistic is the person who comes for one session or maybe two sessions, and then they drop out of treatment. Now, that's a bad decision, but it's also a reflection of how you conduct that first session. And I'm going to say more about that, but I will simply say at this moment, how you conduct the first session is critically important. I've already said the first goal of treatment is to shift the person from a stable to an unstable attributional style.